An educationist, Olajumoke Balogun James. She is an education law enforcement consultant for the Dutch municipality government. She joins us via Skype from Netherlands. We'd like to thank you for joining us on the program.
Well, thank you for having me.
I'd like to begin by asking how Netherlands is doing containing the spread of the virus.
Well, right now we can actually be proud of getting the situation under control. In the recent weeks, we've not had any increase in the number of infected people. So we have actually broken the curve, as they say.
Because, if you recall, April, you had, I think, your peak at that time, but now we're really seeing a flattening of the curve with recent reports. But I'd like to ask about the measures in terms of the lockdown. Countries have come from total lockdown to partial lockdown to schools reopening. In terms of education, are schools open?
Yes, we were open right until vacation last week. We had a partial opening, but most of the time the kids were still following their lessons online anyways. But at a particular time, sometimes end of beginning of May, kids could go back to school. So yeah, that was what happened till last week before the schools went on holidays.
So what was the experience for the students, the pupils? Could you share the kind of experience with regards to adapting this COVID-19 era?
Well, adapting was a little bit difficult, but the compliance level is very high in the Netherlands. We are kind of law-abiding citizens, including the kids. So you see people, reminding one another of the 1.5 meters distance, social distancing measures that was taken or still active now. And for the schools, it was maybe a little bit difficult at the beginning to get all the kids to enjoy the same level of education and quality as they had before the COVID started. And when they had to go back, because a lot of measures had to be put in place, we had to come up with strategies to make sure that we reduce the infection or the transfer between the kids and the staff. I mean, obviously, it was proven that most transfer were made between the adults and not kids themselves. And knowing that, it was easy to actually come up with protocol to make sure that the staff was able to keep their distance in the classes and within themselves, and kids were exempted from wearing masks at a particular time. So they could sit in class, they could do things together. Physical activities were allowed, are still allowed right now, but the adults had to be very strict and they had to follow the protocol as was stipulated by the health organization or the National Health Organization in the Netherlands.
So how did schools divide the children, for example, into classes? If perhaps you had a class of 12, was it the same number, or did they spread them across classes?
Okay, we had about 7 measures that needed to be taken, and that was to guarantee that we had well-ventilated spaces. In classes where you had more than 25 kids, which obviously doesn't really happen often, but in some special schools, you have kids that are, sitting together, maybe up to about 20, 25. They had to come up with a plan to make sure they made groups all over the schools. So the classes are splitted into two, and they reduced the hours of lessons. So maybe the first group was coming in at about 8 till about 12. The second group will come in at about 1 till about 4 o'clock. And they made sure that the classes remained the same. So the cohort remained the same. So you can go from the first group to the second group. And that was just to make sure that, the kids were able to get used to each other and to be able to know if eventually anything happens, to know where it came from and which group they had to deal with. They had to do that all over the schools, and in some cases where we were sure of kids with pre-existing health issues, those kids had to stay home. So those kids didn't get to go to school at all. They had their lessons at home and online. But kids that were certified healthy with no problems, they could come to school in cohort. And the teachers had to maybe do a little bit more, but they were the same teachers, they had the same hours, and they were the one that really needed to actually, distance themselves from other adults and not necessarily from the kids, because there was a research and the data that they presented to the health ministry was that kids within the ages of 0 till 17 were not getting ill. Out of the total population of the sick kids in the Netherlands, we had just about 1.3% of the hospitalized patients were kids, were infected, and 0.6% had to go to the hospital. And so it's a really small, population of the whole population. And that said enough to know that kids were not really at such a risk if they continued school or their sporting activities or any other activities they had. And knowing that, we were able to come up with, protocol and strategies to make sure that every school was able to reach out to the kids, give them the lessons they needed, even if it was just, for a couple of hours in a day. And that was how we did it till the vacation.
Okay, so I guess, as Nigeria opens up with the exiting students writing their exams, there are many things that we can learn from the example there. We'd like to thank you so much, Olajumoke Balogun James, Education Law Enforcement Consultant. Thank you for joining us on the program.
Thank you for having me.